This procedure uses a balloon and possibly a stent to improve blood flow. When fat, cholesterol, and other substances build up in the walls of arteries, narrowed or blocked arteries or veins may occur and put your life in danger. Angioplasty is a minimally invasive procedure used to open up the blood vessel. Take this coronary angioplasty for example. The doctor places a guide wire from the patient's wrist into the radial artery. A flexible tube is advanced over the wire and moved inside the coronary artery. It works with a special dye to help doctor locate the blocked heart artery. A balloon is then moved to the blockage and inflated to widen the artery. If needed, a wire mesh tube called a stent will be inserted during the time of ballooning. It will stay in place to keep the blocked heart artery open. In addition to the coronary arteries, angioplasty can also treat hardening and narrowing, found in the patient's abdominal, leg, and renal arteries. There are some stent innovations on the market that improve expansion performance.